Imagine waking up each day with a painful, open sore on your foot or leg. It's not healing, and you don't know why. The pain is keeping you up at night, and the skin around it is tight, dry, and shiny. You wonder, why won't this heal? What am I doing wrong? That's the daily reality for people dealing with ischemic ulcers, a chronic and often misunderstood health problem. What are ischemic ulcers? Let's break it down. Ischemic ulcers are a type of chronic wound, usually found on the feet, toes, or lower legs, caused by a lack of blood flow. Without enough blood, your body can't deliver the oxygen and nutrients needed for your skin and tissues to heal. This happens when blood flow to a specific area is restricted, often due to conditions like peripheral artery disease, PAD, or diabetes. You might hear the term ischemia, which simply means that the blood flow is reduced or blocked. And if that happens, the tissues in that area start to die, creating what we call an ulcer. Imagine it like a garden that hasn't been watered in weeks. Everything starts to wither and die. That's similar to what happens with an ischemic ulcer. Why do ischemic ulcers occur? Ischemic ulcers happen because blood flow to the lower limbs gets interrupted. Blood vessels, particularly arteries, are meant to carry blood full of oxygen and nutrients to your tissues. But when these vessels are narrowed or blocked, those nutrients can't reach certain areas. Many things can cause this blockage. Peripheral artery disease, diabetes, and even smoking play a significant role. Conditions like high blood pressure and high cholesterol, or habits like a sedentary lifestyle, make things worse by increasing the chance of poor circulation. Your feet and legs are the most vulnerable because they're furthest from your heart. When your blood can't make it all the way down there, it can't heal damaged tissues, and ulcers form. The difference between venous and arterial ulcers. You might also hear about venous and arterial ulcers, which are two types of ischemic ulcers. Think of venous ulcers as a traffic jam. Blood can't make it back up from the legs to the heart as well as it should, often because the veins are damaged. Venous ulcers tend to be shallower and often appear around the ankles. On the other hand, arterial ulcers are a problem with the arteries that bring blood from the heart to the legs. These ulcers are typically deeper, symmetrical, and have well-defined edges. You'll usually find them on bony areas like the tops of the feet or toes. While venous ulcers are the most common type of leg ulcer, arterial, or ischemic ulcers are particularly dangerous because they're harder to heal. Risk factors you should know about. So, who's most at risk? If you smoke, have a high body mass index, BMI, or a family history of circulation problems, your chances are higher. Even certain joint or skeletal diseases in the lower limbs can increase your risk, as can being inactive. These factors all put extra pressure on your blood vessels, making it harder for blood to reach your legs and feet. Recognizing the symptoms. If you have an ischemic ulcer, you might notice a deep, open sore on your foot, ankle, or lower leg. Dark red, yellow, gray, or black areas in the ulcer. A punched-out appearance with clear borders, skin that's shiny, tight, dry, or even hairless around the ulcer. Severe pain that gets worse at night, and maybe even a weak or absent pulse around the area. These symptoms can make life extremely uncomfortable, especially since ischemic ulcers tend to heal very slowly. Without proper treatment, they can even worsen, leading to severe infections or even amputation. How are ischemic ulcers diagnosed? A doctor will start by examining your ulcer and checking your skin for signs of ischemia, like pale, bluish skin or a faint pulse. Next, they might perform some specific tests to understand your blood flow better. Capillary refill time. A simple test where the doctor presses down on your skin to see how long it takes to turn from white back to normal color. Buerger test. Your leg will be elevated to check if it turns pale, indicating poor circulation. Doppler ultrasound. This test uses sound waves to get an idea of how well blood is flowing through your arteries. Transcutaneous oximetry. This measures the oxygen level around the ulcer, which can tell the doctor if your tissues are getting enough oxygen. Angiography. A more advanced test where a dye is injected into your arteries to create detailed images, helping locate blockages. Treatment options. Let's talk solutions. Treating ischemic ulcers often requires a combination of approaches. First and foremost, doctors will want to address the root of the problem, poor blood flow. Here are some common treatments. Wound care. The ulcer needs to be kept clean and protected. This includes dressing the wound properly and making sure it's free from infection. Medications. Depending on your situation, you may be prescribed antibiotics to prevent or treat infections. If you have diabetes, blood sugar management will also be critical. Lifestyle changes. Smoking cessation, eating a healthier diet, and incorporating gentle exercise, as recommended by your doctor, can make a world of difference. For more severe cases, doctors might suggest procedures to restore blood flow. Angioplasty. In this minimally invasive procedure, a tiny balloon is placed in the blocked artery and inflated to widen it. Sometimes a stent, a small mesh tube, is placed to keep the artery open. Bypass surgery. This is a more involved surgery where a healthy blood vessel from another part of your body is grafted onto the affected artery, creating a new pathway for blood to flow around the blockage. Prevention and aftercare. The best way to avoid ischemic ulcers is by taking good care of your circulatory health. Avoid smoking, eat a balanced diet, and try to stay active. Even simple activities like walking can help improve circulation over time. If you have diabetes, regularly monitor your blood sugar levels and follow your doctor's advice. After treatment, your doctor may suggest regular follow-ups to monitor healing and make sure your treatment plan is working. These checkups are essential to prevent any recurring issues and to address new problems quickly if they arise. Conclusion. Ischemic ulcers are more than just a skin condition. They're a sign that your circulation needs attention. By understanding the risks, symptoms, and treatments, you're already on the path to managing them better. Whether you're dealing with an ulcer now or just trying to prevent one, small changes can make a big difference. Your health is worth the effort, so start today.